All right, so we're moving on to Unit 2 information. So we're revisiting Chapter 5 just to talk about the burn section from Chapter 5. Um, so this PowerPoint is simply just talking about burns. They're pretty important. Basic things about burns and thoughts about burns are going to be need to know kind of for the test and forever. So Chapter 5 talks about first intention and second intention. First intention is the healing process where we have more of an incision, an incise wound, very like structured scab forms, granulation tissue, and then small scar with a lot of the tissue that was there before is replaced. That second intention is much more granulation tissue, larger area filled with scar tissue to fill the gap. Just keep in mind with scar tissue and healing that if the more scar tissue I have, the less functionality I regain. I want the tissue to get healed and replaced with the same type of tissue. Scar tissue is just to kind of bridge a gap, basically, and it doesn't hold the same functionality. So burns, some of the things that can cause burns, thermal. This would be hot flames, hot liquid. This is going to be your most common from you know uh, actual house fires, hot liquids, children burning hot water in the bathtub, that sort of thing. Um, Chemical radiation, electrical burns, UV light, technically, sunburns, and even friction. The severity of a burn really depends on what's the cause, the temperature involved, and the amount of time in contact with our skin. Um, and also the burn surface area and also the site of injury. So again, a burn on our hand or finger or arm with a small percentage is much less critical than say for example a burn to someone's face, much more devastating than someone to the burn of like a finger or toe or soles of our feet or something like that. So location matters and the amount of surface area that's burned matters. So burns get classified in basically three main categories. Um, Superficial or partial thickness, those are first degree burns. This involves only the epidermis and part of the dermis, little of any blister formation. There's going to be some pain and redness. Superficial, partial, first degree, sunburn, a mild scald from touching a hot pot, that sort of thing. Um, second degree is a deep partial thickness. So you have superficial, deep partial thickness. Second degree uh, is usually almost always going to have some blistering formation happening. It's going to be part of the epidermis and into the dermis, and therefore there's going to be some nerve injury, stuff like that. Usually, you're going to have severe pain and just increased hypersensitivity in general. Um, Risk with deep partial thickness, the second degree, is going to be infection and large amounts of scar tissue formation. Full thickness, technically third, technically fourth degree, um, full thickness burns. Um, this is a complete destruction of all skin layers and often into the hypodermis, the connective tissue layer underneath our skin, our cutaneous membrane. There's going to be the wounds are going to coagulate and be like charred. It's going to form this layer probably of damaged dead tissue, sometimes turning black, and this is known as eschar. Sometimes initially, the unique thing for these for full thickness burns is they initially may not be painful, and that's just because all nerve endings for sensation and pain receptors have been completely burned, completely destroyed. Um, but of course, as it tries to heal, there's going to be pain as those nerves try to regrow. This is a visual representation of this. So again, with superficial first degree, you're going to have definitely some redness and some pain. Partial thickness, the second degree, you're going to have swelling and blisters, much deeper burn, a lot of pain, extreme hypersensitivity. And then full thickness is all the way again into through the dermis or through the epidermis, dermis, and into the hypodermis, the layer of connective tissue and fat and other things underneath. Could be muscle death and all kinds of other tissues affected, and usually have much more severe symptoms, much more systemic systems with full thickness burns, which makes them so much more scary. So if a client experiences severe pain, has serious exudate, a blister development from the recent burns, what degree burn is most likely causing these signs and symptoms? If you said number two here, second degree, that would be correct. The key there is severe pain, drainage, blister development. Those are all indications of that kind of partial thickness, first two layers affected. So partial thickness burn, you can see layers of skin removed. We've got blistering happening. Deep partial thickness burn. Again, more into the third, fourth degree burns. You can see the skin looks dry almost. There's some redness there. Severe loss of skin layers. Full thickness. This would be working into still third degrees. Uh, Third degree and fourth degree where there's that blackness, eschar tissue, um, that sort of thing. So effects of burn injury, there's going to be local. But there's again with the more severe burns, second and third degree, depending on the location and the amount surface area of the body that's been burned, you're going to have high possibility of systemic effects. So some of the systemic effects too. If you're going to take home any points from this discussion about burns from this part of chapter 5, it's for you guys, it's kind of think about the complications here. So dehydration, edema, shock, respiratory problems, pain, infection, metabolism due to healing period after a burn. So let's talk about these, right? So the most important thing to need to know is think about the complications. So what is shock? Shock is usually that there's no bleeding related to this, or because the capillaries and the other tissues been coagulated under the burn, and our inflammatory response occurs, and then there's a large burn surface area. A lot of times, the dehydration, edema, and shock all go hand in hand because if there's a large area, there's usually a lot of loss of water and protein. They shift out of capillaries because these capillaries have been coagulated are blocked off, and the shifting of fluid and protein usually goes into tissue. So this overall causes that loss of the osmotic pressure in the capillary. So we're going to lose blood volume. There's the kind of dehydration, and fluid's going to shift into other spaces like interstitial space. There's the edema, and because we have decreasing blood volume, making it more difficult, for the body to maintain this blood volume, and these large shifts of fluid and proteins causing the edema. This could lead to kidney failure because they're not having enough blood flow, damage to other organs. Again, shock and dehydration edema can go hand in hand. You're going to start with the dehydration edema just because of the coagulation of those blood vessels and the shift of fluid and protein. And depending on, again, how big the surface area is, this could lead to shock, shutting down kidneys and other vital organs, and something that could be very extensively a big deal for somebody. The reason someone might have respiratory problems is think about why they're in like a house fire or something like that. So we have large amounts of carbon monoxide. This is a chemical from smoke inhalation, and carbon dioxide is what we normally breathe out, but carbon monoxide with an M tends to actually take the place of our O2 on hemoglobin. So if someone's exposed to large amounts of carbon monoxide, say in a house fire where there's all the smoke, there's potential for a lot of the red blood cells to pick up that carbon monoxide molecule and not have room for O2. So you're going to have low O2, you're going to have respiratory symptoms, shortness of breath, pneumonia, maybe even lung infections from this. So this, especially respiratory problems, definitely more prone to people that have been in burns with like house fires and a substantial amount of smoke. Pain overall is about treatment. As skin grows and you're trying to heal, it's going to be a lot of pain, and that's a highlight for burn victims. The need, probably from all these, the most concerning and most common issue that comes as a side effect of burn injuries is infection. Just simply think about, we've lost our protective layer, so burn wounds must be cleaned thoroughly, have very rigorous schedule with cleaning burn wounds, and those severe, uh, severe burns, um, that deep partial thickness, degree 3, especially are going to need, probably going to have dead tissue that piles up, that blackened dead tissue called eschar, and they're going to need debridement. They're going to need that tissue kind of removed, because that tissue basically can also promote shock, just because it's again, like I talked about, it's kind of blocking the capillary, excuse me, and limiting the movement of blood flow and a lot of fluid shifts. And then also, again, infection is going to cause a sepsis shock, because if infection makes its way into the skin, it's much easier now with the burns that it's going to end up in the bloodstream, and that can make its way around the whole body, and that's called sepsis, and that's a bad deal. So serious issues, the most concerning and most common is probably definitely the dehydration, edema, and just overall fluid shifting. But you kind of need to know to think about is definitely infection. That's your biggest concern with someone that has burn injuries. And then hypermetabolism is just saying, because we're trying to heal, we have to have increased protein, increased carbohydrate intake. So that's going to be something that has to be managed. But your leading cause of death or issues with burns is going to be infection. So highlight infection in your brain. This is some more. These are showing some kind of infections that have started with burns. The one on the right, these are not need to notice. The one on the right is the Pseudomonas aeruginosa. Kind of has this bluish green color to it. All bad news. All requires a lot of follow up. So another question: they're caring for a client with a deep partial thickness burns, which find indicates that the burn injury has progressed to full thickness. So deep partial, this is somewhere in between stage 2. What would say that we note now that these are stage 3 or full thickness? That's right. So number 2, the white leathery skin with no pain in the burn area. That's kind of trying to indicate the stage 3 to stage 4 full thickness burns. Swelling, redness, blisters. These are all kind of stage 1, stage 2 symptoms. So healing of burns, just as a note, again, hypermetabolism, a lot of trying to heal. We need increased nutrition, wound care, covering of the wounds, that preventing infection is your biggest deal. Healing takes a long time. There's going to be scar tissue that develops, even if someone gets skin grafts to replace the lost skin. And again, scar tissue, I made the note, that means it loses functionality. So someone's ability to temperature control, fluid control that our skin does might be lost. And sometimes surgery, again, like that debridement, might be necessary if they're really deep and really involved, to remove some of that eschar, that dead tissue, and get it out of the way. One of the big kind of need to know from this chapter is just make an interesting note to yourself that with children and burns, there's more considerations and time involved in healing for children, mainly because they're in their growing phase. And so their growth period could be affected by an acute burn and compromise their metabolic needs. There tends to be an increased inflammatory response with children, and they usually require more additional skin grafts, more additional healing processes. So there's a lot more involvement with children, and then the risk of infection tends to be higher just because of that. So keep that in mind. So questions to kind of help us understand all this. Client with severe burns are receiving fluid resuscitation. So we're giving them some IV fluids. Which assessment finding indicates the treatment is effective? So these are some more NCLEX style questions I thought we would throw here at the end to try and think about it. So this is asking which assessment indicates that me giving them IV fluids is working effectively. Following a bird. If you said number one, you're correct. So typically, this isn't what urine output we want. We'd want anywhere above 30 milliliters an hour. But all these other things, too, you can note that these kind of indicate that me giving this person fluid is not working. There's still severe loss of fluid here because blood pressure here, low, heart rate up. That's also indication of dehydration or fluid volume deficit. Severe potassium or potassium elevated like this, that's indicating severe dehydration. Hypoperfusion of the kidneys, maybe, and so potassium is climbing. These three are all bad news of severe fluid deficit, that sort of thing. That this is not working. This is the one that's kind of showing that fluid resuscitation is working. So look at this: the nurse is monitoring a burn patient with signs of acute kidney injury. What pathophysiological factor is responsible for acute kidney injury in burn patients? So what's causing acute kidney injury in a burn patient? Based on what I was just talking about, this one should be pretty. This is hypovolemia. There's not enough fluid in the blood flow and the vasculature. Therefore, the kidneys aren't getting enough blood flow. They start to fail. Last kind of NCLEX style question. The client has a full thickness burn, is at risk for compartment syndrome. Maybe, hopefully, you've heard of that before. What is the primary pathophysiology mechanism behind this condition? So, what would be the potential cause of compartment syndrome? I hinted at this, so think about it for a minute. Yeah, pause the video if you need to. If you said number three, you're correct. So again, this is what could lead to like compartment syndrome. Means that the cut off blood flow to a certain part of our appendages or a certain part of our body, and causes increased fluid shifting in the tissue, huge amount of pressure, and it can cause damage to tissue. This would be a case of severe deep full thick or more like full thickness burns, state third degree, fourth degree burns that are causing that dead tissue on top. And now the blood vessels can't get where they're supposed to go. They've been cauterized off, and that fluid shifts out of the blood vessels and shifts into the tissue and just keeps shifting until there's nowhere for it to go because there's all this dead tissue. It's blocked, and it kind of causes this whole system to just have a blocker, and now the fluid can't move anymore. And so that can cause compartment syndrome. It can cause a lot of injuries. So again, to highlight the burns section, really just think about some of the big complications with burns, and then know first, second, third degree and kind of their differences. That's your take home point from burns. All right, so we're going to move on to skin disorders, chapter 8.